notice board, and have extra cups to reduce plastic bottles. We are reducing electricity by shutting our monitors off when they're not in use, and by turning off our lights. We're reducing our carbon footprint by using Teams meetings, and we're working from home. We have reduced our paper by limiting our printing, and we keep everything that we can reuse. These may only be little steps, but lots of small steps can make a huge difference.
Drop rabbits.
No people was there where?
At the beach to drop rabbits.
Less people were going around, which kept natural habitats intact so they weren't being destroyed and wildlife was living freely.
Obviously, like, it's getting loads of people, but it's not as much people going out. So it reduces the gases in the air. Like.
They're at home, not wasting as much food, and also in light of the recent Free School Meals campaign, people are a lot more conscious about the food they're wasting and the effect it has on the environment.
And less people are going on holiday, so not so many flights and not so many tourists, so less rubbish and pollution from their cars.
I believe if we try to improve on these negative impacts and try to keep up the work with our positive ones, we're able to make a better environment.
Welcome to Ray of Light. We're a registered charity providing support to anyone affected by cancer.
We work here alongside the sustainability team in Velindre in the Cancer Centre, providing weekly sessions every Tuesday.
We're using natural resources to connect people with nature, and it's inclusive for all abilities.
Please come and join us.
Hi, I'm Kate Webb. I'm the Environmental Officer for an Iron Bevan Health Board. Part of my role is to assist in the management of our waste segregation system, where 95% of our waste is diverted from landfill through recycling or energy from waste. As part of our sustainability goal, we're also looking to divert the other 5% from landfill, and that's something that we're currently working on. We've also got food waste segregation at 4 of our main hospital sites, and this is sent for anaerobic digestion, and this is also energy from waste. And one of our major achievements, and a world first, is the introduction of the Sterimelt machine. This melts down polypropylene from theatres and then is turned into a recyclable material, which then aids the circular economy. We're continually talking and meeting with staff across the health board, looking at different innovative ideas to increase our recycling and create a more sustainable future.
It's been about challenging myself to feel uncomfortable and have those conversations and to understand it in relation to HEIW and work and what we can do here, as well as what I can do personally.
So in a recent stint of Love Your Garden, a group of HEIW staff recently rose to the occasion, pardon the pun, to transform the grounds of Dysgu.
It's just important, and I think it gets swept under the rug, and there's so much greenwashing that happens. The fact that HEIW doesn't just say it wants to do things, it actually does the things.
Community-supported agriculture is a partnership between farmers and consumers in which the responsibilities, risks and rewards of farming are shared. Members pay monthly subscriptions and in return they get organically, locally grown produce. So how did the Health Board get a CSA? Well, a Natural Resources Wales study identified a need for locally grown food in the Swansea East area. The Health Board had land that was unsuitable for healthcare development but ideal for growing. So Swansea Bay University Health Board then approached me as I was looking for available land. In November 2021, the project led by Amanda Davis was approved with a 10-year lease given at a peppercorn rate. We have now been on site from May 22 with the first harvest expected in May 23. The food produced will feed around 150 households per week, and this project supports the Health Board's wider work on both the Wellbeing of Future Generations Act and wider sustainability issues.
Theatres are energy hotspots, so for our quality improvement project, we wanted to focus on saving unnecessary waste from anaesthetic systems to reduce carbon footprint and financial burden. We brought in measures to turn off anaesthetic gas scavenging systems when not needed in all areas of the hospital, and anaesthetic machines, monitoring equipment, and computers when they were not needed in theatres. Compared to if everything was constantly left on, bringing in changes such as these LED lights and these printed signs in ED and interventional radiology, we are saving more than 73,000 kilowatt hours over the course of the year, which is the equivalent energy used to power almost 20 average UK houses, driving over 96,000 miles and £17,000 in power costs. We hope that this highlights the potential for further work on this type of saving to make our healthcare system more green and sustainable.
Good morning. We set out to reduce the carbon footprint in hand surgery by decreasing the number of instruments, pictured on the left, and eliminating all of these single-use drapes and single-use instruments in carpal tunnel surgery. We changed our setup to, pictured on the right, lean and green setup, and small drapes, pictured on the right. And we also bypassed ward admission through a green patient pathway. Half the time spent by each patient and half the manpower required. And as such, we performed 43 patients over a 6 months period and decreased the waste by 1/3. Run chart shows this. And decreased the carbon footprint emission by 80% and saved £35 per each case So 80% of carbon footprint reduction, 65% less of clinical waste and economic savings. Thus achieved a sweet spot of sustainable surgery. We predict approximately 2 million savings and 1,200 less carbon dioxide across the UK with these principles. Thank you.
Hello, I'm Morriston Powell and I work for Public Health Wales's Health and Sustainability Hub. We recognise that the climate and nature crises will have significant impacts on people's health and well-being, and we want to support and inspire our colleagues and others to take positive action. Over the last few years, the Hub has developed lots of resources and guides to support staff to take action on sustainability. Today, I'm pleased to share our new Resources for Sustainable Health e-catalogue, which brings our resources together in one place, a one-stop shop to help individuals and organisations consider the natural environment and the health of the planet and people in everything they do. In our e-catalogue, you'll find links to our Green Opportunities e-brief, Be the Change e-guides, the Wellbeing Goals Challenge, and our Healthy Environment online workshop, which enables action on decarbonisation, biodiversity and resource efficiency. The Hub has had a big focus on decarbonisation in the last year. We've delivered free carbon literacy training, we've developed PHW's Decarbonisation Action Plan, produced an infographic to highlight how people can take action to reduce emissions, we've been encouraging staff to adopt healthy travel behaviours, and we've established a Green Advocate staff network, which meets every 3 months to discuss, learn and take action. Please do check out our resources and get in touch.
Good morning everyone. We would like to share our Sustainable QI project with you all. The aim of the project was to reduce the usage of paper drug chart in the Pediatric Assessment Unit without compromising patient care and safety. Currently, the drug chart used in pediatrics is a hard sheet chart which has got 3 sheets incorporated. We collected data over 1 week period. Our results showed that 36.7% patient had the drug chart used to prescribe 1 to 4 medication. Hence, we suggested incorporating drug prescription table in our Pediatric Assessment Unit clerking sheet, which is what looks like what you can see on the screen, and it has all the elements to safely prescribe and administer medication. Hence, putting this in perspective, in a unit like ours, we will be decreasing approximately 2,000 drug charts per year, which means that there will be less trees cut to produce the paper, hence less carbon emitted in production and printing of these drug charts, and needless to say, less emission associated with transportation. Thank you for listening.
Hi, I'm Ellie, the current CSH Sustainability Scholar in Ophthalmology, working hard to help reach net zero in Wales by 2030. Key projects I've been involved in so far: surveying staff attitudes towards waste and cataract surgery at health board and national level, 2, streamlining disposable custom packs, transitioning from single-use to reusable. Thirdly, setting up a green theatre group, implementing a nighttime theatre shutdown checklist. Fourthly, tackling plastic pollution in the trust, switching from plastic water bottles to potable tap water, saving the trust £75,000 and 80 tonnes of CO2 equivalent per year. I will continue to work to help build a sustainable community in ophthalmology and beyond.
Hello, my name is Laura Burton, here from my back garden, and I am an ear, nose and throat registrar in Cardiff. So I'm quite new to the sustainability world, but I've been given permission to crack on, so that's what we've been trying to do. So the main project we've been looking at is trying to embed the change with our fractured noses. So during COVID, they all started to be done under local anaesthetic, whereas previously they were done under general. So we're just trying to embed that change, which has led to reduced equipment and reduced carbon footprint, reduced theatre time, reduced staff time. Patients no longer require sick days as they can come and go the same day, and reduced travel as well. We've also been looking at standardising UK use of equipment for wax microsuction, and just in general just trying to promote sustainable ENT within Wales, and keep your eyes out because hopefully there will be a green ENT group coming soon.
Hi, so my name is Sian Jones and I am the Operational Manager within CD&T Clinical Board, so Clinical Diagnostics and Therapeutics within Cardiff and Bell University Health Board. As part of my role, I am looking at sustainability across the clinical board, and one of the main projects I'm looking at the moment is within cellular pathology and how they use single-use plastics within their processes and how we can reduce those to support patients and the environment. Also involved in promoting sustainability generally across the clinical board, and I know that we've got some really great work going on with dietary, AWTTC, some really great stuff with pharmacy and dietetics, and looking to, from those experiences, produce a case study library so that others can be inspired and look at what's going on and see how they can replicate.
With an estimated 10,000 people in the UK being newly diagnosed with lung disease every week, the need for providing pulmonary rehabilitation has never been greater. However, due to our rural environment and the travel required to access services, some of our most vulnerable patients are not receiving this service. The World Health Organization states that 2.2 million people die prematurely from air pollution every year, and 44% are those with respiratory disease. So as healthcare providers, we need to create innovative ways of delivering sustainable services and reduce the negative impact on the environment too. Our virtual pulmonary rehabilitation, or VIPER service, does just that. By using telemedicine and video conferencing, we created a hub and spoke model and saved 7,579 miles of travel and reduced driving time by 9 whole days across the 2 programs. This reduced carbon dioxide emissions. The VIPER model can be applied to other specialties, so both our patients and our planet benefit from innovative service delivery.
Hi, we're Wrexham Maelor Green Group.
We're established in September 2021.
And since then I've been working hard to embed
the sustainable healthcare ethos across our hospital.
Here are some of our successes.
We've been reducing the environmental impact of inhalers through promoting the use of inhalers that have a smaller carbon footprint.
We've been looking at ways to reduce our energy usage in theatres. We've introduced a theatre shutdown checklist, making sure that electrical equipment and scavenging is turned off out of hours.
And I've been looking at reducing the environmental impact of certain NHS practices by reducing the waste associated with piped nitrous oxide manifold systems. We found a solution switching over to the cylinder systems and hope to have them off by the summer.
We've worked with our catering department to reduce its environmental impact. Food waste is now collected and taken to an anaerobic digestion facility. The process there produces fertiliser for farmers and biogas, which is fed back to the grid.
We've removed our desperate vaporisers, reducing our use to zero. This has cut our emissions, saved money, all with no impact on patient care.
We've been rejuvenating one of our courtyards to improve biodiversity across the hospital site, as well as create an outdoor space for our staff.
We have tackled plastic pollution by switching from disposable plastic water bottles for patients and staff to potable drinking water.
This is just the beginning.
The Wellbeing Project on the site of Landock Hospital. Hives with several thousand bees are well positioned for all the bees' needs. Inspecting is weekly, sometimes twice a week during the summer months, but in the winter months it's often twice a month as they don't like the rain. Harvesting is a team effort as it is hard work, but the end result is golden nectar. Raising funds for the coming year, we held a charity honey day, which was great fun and we had a lot of support. And finally, thank you to everybody for all their hard work, for all those involved, and especially for our beekeepers and for you taking your time to read this. And now you'll all be thinking about it. Diolch. Welcome to our green space at HEIW. Piece of garden that was needing some love and attention. We spent many months against difficult times digging and pulling weeds, along with recycling pallets to make planters and trellis. We had support from Cardiff Health Charity and were able to ask an artist to come along and splash some colour. We had support and funding from the League of Friends and were able to purchase bee-friendly plants for our resident pollinators. We now have a lovely, peaceful and welcoming space for both staff and patients to sit and reflect on their day, made possible by the activity staff, patients of HEIW, donations and support from Cardiff and Vale Health Charity, League of Friends and the beautiful art by Amelia. We still have areas to improve and work on, but I hope you would agree it's already a good use of green space. Thank you and diolch.
Hi, my name is Jill Morgan. I'm a senior physiotherapy lecturer at Cardiff University and I'm embedding sustainable environmental practice into the curriculum here. The School of Healthcare Sciences has recently signed up to the Environmental Physiotherapy Agenda for 2023, which challenges all physiotherapy curricula around the world to include the environment in teaching practices. I've been teaching our final year students how planetary health and public health are inextricably linked and encouraging students to reflect on how environmental influences can feed public health inequalities. From 2022, we'll have new MSc pre-registration physiotherapy programmes, which will include a module that explores this relationship in more depth. And there'll be a focus on 3 strands for change. 1, personal responsibility and role modelling, how we act as individuals. 2, implications for our clinical practice, so how we influence patient care. And 3, service-wide or whole profession action, so quality improvement drivers. We'll start with the global picture and the Sustainable Development Goals before then drilling down into more local issues affecting health in Wales. Students will explore Wales, its history, demographics, industries, physical environment and socio-economic factors relating to inequality in health. And we'll consider the impact of urban design, active travel policies, the 15-minute city model, green spaces, ultimately all focusing on behaviour change. Students will work interprofessionally to produce a public health intervention or a campaign or an initiative, which they'll then present at a symposium to showcase their ideas to stakeholders, employers, academic staff, peers and patient public involvement groups. So starting with the professionals of the future is an important sphere of influence for this change, and fostering their creativity and collaboration could give rise to some really exciting solutions.
Fathom Trust is a charity and we bring people together around 3 things. These are craftsmanship, conservation of natural places and contemplation. And we do this to create health and to promote healing. And we are working with different landowners, farms, large houses around Wales to set up a network of healing communities.
What Fathom Trust does, it breaches that gap between what the NHS has and what we have locally, so we can connect with local communities and offer patients something close to them where they can go and get mental health therapy and support without prescribing.
By working with wood, by working with stone, by working in particular places that have a vitality of their own, this draws out our inner life and connects it to the inner life of the world around us. And so the mind, the body and the spirit wonderfully weaves together and we discover something we never knew was possible before.
Diving into that workbench, diving into the leather, working with it, loving it, and then stitching it, focusing your mind, and then something just drops down on your workbench and you think, I made that. Look at it. It's beautiful.
Hello, so my name is Rachel Drayton. I'm the Clinical Director of the Department of Sexual Health in Cardiff Royal Infirmary, and I'm just going to talk to you briefly about what we've been doing in the department to minimise our environmental impact. So the first thing we did was set up some notice boards in the department. So we set up a Sexual Health versus the Climate Emergency Board for people to write down ideas of things that we can do in the department or in general life to decrease our environmental impact. Things like, buying less new things, driving less, eating less meat, etc. And some war on waste boards in the department where people could just write down areas where they noticed we could improve our waste. We got a group together, and the first thing we looked at was about recycling. So we realised that there were a huge amount of packaging that we used in the department that just went into the black bins because of lack of availability of the recycling bins. So we purchased some recycling bins and improved our recycling that way. We also noticed that there were lots of things going in clinical waste bins unnecessarily just because of the lack of availability of black bins. So we increased the number of black bins that we had available. We've also looked at how patients attend the service, so we've tried to minimise patient journeys if possible, and have embraced the use of video consultations, which have worked really well and been very popular for certain sorts of consultations, and otherwise minimised unnecessary patient journeys. We're currently looking to decrease our use of single-use items, in particular single-use plastic speculum, and looking at purchasing some metal speculums that can be autoclaved as well, just to decrease our carbon footprint. Lastly, we are trying to encourage people to switch off lights, switch off devices, switch off their computers when they're not in use, to decrease our carbon footprint. We've got lots of other ideas we're looking at trying, and we look forward to putting them into action and improve things for everyone in the future. Thanks for your time.
Hi everyone, my name's Shireen Kassam and I work as a consultant haematologist. I'm also really passionate about promoting healthy plant-based diets for personal and planetary health. And I do this through my community interest company called Plant-Based Health Professionals UK. I've built a network of like-minded individuals who are providing education and advocacy on healthy plant-based diets. We know that to improve and mitigate the climate crisis, we need to shift to a healthy plant-based diet. Not only is it going to be best for the climate crisis, but it's also better for our personal health. Unhealthy diets are now one of the leading causes of death and disability, and one of the main reasons our patients need to seek our help within the NHS. You can find out more information at plantbasedhealthprofessionals.com. We have loads of resources free to download that you can use with your patients and in your workplace.